Hello, my friends. I found something else. You don't know this, but it's my third time trying to do this with three kids, Makes it a little hard sometimes. But this says May 1990. Lithium in drinking water and the incidences of crimes, suicides, and arrests related to drug addictions. Using data for 27 Texas countries from 1978 to 1987, it is shown that the incidence rates of suicide, homicide, and rape are significantly higher in counties whose drinking water supplies contain little or no lithium than in counties with water lithium levels ranging from 70 to 170 micrograms per liter. The differences remain statistically significant. After corrections for population density, the corresponding associations with the incidence rates of robbery, burglary, and theft were statistically significant, with p less than 0.05. These results suggest that lithium has moderating effects on suicidal and violent criminal behaviors at levels that may be encountered in municipal water supplies. Comparisons of drinking water lithium levels in the respective Texas counties with the incidence of arrests for possession of opium, cocaine, and their derivatives, morphine, heroin, and codeine from 1981 to 1986 also produced statistically significant inverse associations, whereas no significant or consistent associations were observed with the reported arrest rates for possession of marijuana, driving under the influence of alcohol, and drunkenness. These results suggest that lithium at low dose levels has a generally beneficial effect on human behavior, which may be associated with the functions of lithium as a nutritionally essential trace element, subject to confirmation by controlled experiments with high-risk populations. Increasing the human lithium intake by supplementation or the lithiation of drinking water is suggested as a possible means of crime, suicide, and drug dependency reduction at the individual and community level. All right, and then I found this other one. Lithium Updated. Human Knowledge Using an Evidence-Based Approach, Part 3. I couldn't find Part 2, but this is from 2009. Lithium use in mental diseases has changed over the years, but remain a cornerstone of treatment in bipolar disorder. In two companion papers, we have reviewed existing and especially recent data on lithium efficiency and updated basic knowledge regarding the practical fundamentals of lithium therapy. The present paper reviews safety data on lithium available to date. Gastrointestinal pain or discomfort, diarrhea, tremor, polyuria, nocturnal urination, weight gain, oedema, flattening of affect, and exacerbation of psoriasis are typical complaints of patients receiving long-term lithium therapy. Renal involvement results in a reduced urinary concentrating capacity, expressed as obligate polyuria, with secondary thirst. With long-term therapy, this may result in nephrogenic diabetes insipidus. In addition, glomerular filtration rate falls slightly in about 20% of patients. The view that only a few patients receiving long-term lithium are at increased risk of glomerular impairment and progressive renal insufficiency should be regarded with caution. The risk is increased in case of concomitant disease or medications. Lithium treatment may inhibit thyroid hormone release and induce goitre. Consequently, the prevalence of both overt and subclinical hypothyroidism is increased, with circulating thyroid autoantibodies frequency being found. Much less commonly, thyrotoxicosis may also develop in association with lithium therapy. Long-term lithium treatment may also be associated with persistent hyperparathyroidism and hypercalcemia, as well as with hypermagnesiism. Sorry, not good at this. Overweight of up to 4 to 10 kg is found in approximately 30% of lithium-treated patients. Most neurological manifestations are benign. For example, the fine postural and or action tremor present in 4 to 20% of patients. This is increased by high caffeine consumption and concomitant use of other psychotropic agents. A number of rare, potentially serious neurological adverse effects have been reported, including extrapyramidal symptoms, pseudotumor cerebri, or occasionally cerebellar symptoms. Severe neurological sequelae are exceptional. Cognitive disturbances are often mentioned as a lithium-related adverse effect. The few controlled studies do show a statistically significant negative effect of lithium on memory, vigilance, reaction time, and tracking. There are frequent reports of mild effects of lithium on cognition of therapeutic serum concentrations. A number of deaths associated with lithium treatment have been reported. The most serious issue is that of non-accidental overdoses. Okay, I'll be right there. Hold on. Either long-term overdoses or acute overdose on long-term treatment. Progressive renal insignificant an exceptional complication of long-term lithium therapy. May also have a fatal outcome. In relation to pregnancy, lithium salts are rated as category D, positive evidence of risk. Therefore, prescription of lithium should be avoided during the first trimester of pregnancy unless the benefit to the mother exceeds the risk of the fetus. Although lithium transfer into breast milk is well established, the long-term fate of babies breastfed by mothers receiving lithium therapy is unknown. Whether lithium therapy is safe in breastfeeding women is controversial. Although there is no absolute contradiction, it is known that the kidney is particularly sensitive to lithium just after birth. Intoxication in patients on long-term treatment with lithium in the absence of history of acute ingestion is not rare. Contributing factors include change in daily dose, long-term high dose, kidney disease, or drug interaction. In suspected cases, serum concentrations should be obtained early and repeatedly. In addition to supportive measures, hemodialysis is the treatment of choice for severe cases. Through knowledge of the limitations and drawbacks of lithium therapy is mandatory for its optimal use, especially at a time when its risk/benefit profile needs to be compared accurately with that of antiepileptic drugs and other mood stabilizing medications. Alright guys, I had to share that. I know I'm not very good at reading words, but that's okay. These English words are very hard, but I had to share that. I don't think it's okay that they put lithium and fluoride and all this stuff in our drinking water. Alright, stay safe. It's pretty nuts.